This was essentially a second-line trial. T-DM1 or Kadcyla is approved for metastatic breast cancer that has progressed on oftentimes what people are receiving are taxane, Herceptin, and Perjeta in the first-line setting. So this trial enrolled patients with metastatic breast cancer that had progressed on taxane and Herceptin. And what's unusual about this trial, and particularly special, is that they allow patients with brain metastases. It's not uncommon to see trials allow brain metastases that are treated and stable, but they not only allowed those, they also allowed untreated brain metastases and those that had had local treatment such as radiation and progressed afterwards. So it was a very high-risk population because they knew that ONT-380 does cross into the blood-brain barrier and has some efficacy there. So they really wanted to allow those patients. And what they saw in the trial was, in combination with T-DM1, a 47% response rate, which was certainly very encouraging. The progression-free survival was over 8 months in this population. And I think what's most exciting, particularly for me, is that the patients that were CNS evaluable had brain metastases that could be measured in the CNS and were able to be classified by RECIST. Over a third of these patients had responses in the brain. I think so. You know, in drug development right now, oftentimes we look at new compounds in the metastatic setting because it's easiest to find the signal there when we're scanning someone every 8 weeks and we know that they have disease. But certainly I think that this is a promising compound and we'll look at it in other settings.